Hello there, my name is Julia. I'm a birth doula and hypnobirthing educator, and today I'm going to be talking all about membrane sweeps, what they are, why you might be offered one, and how they can affect your birth journey. So picture this, you are 38, 39 weeks going to your weekly visits now, and you're at your doctor's office, and they ask if you want a membrane sweep, and you're like, what is this? I don't know what it is. Maybe you've heard about it from your friends, your moms, your sister, your cousin, but you're not really sure what it entails. So what is a membrane sweep? When your provider is performing a vaginal exam, and if you are dilated enough, they can insert two gloved fingers through to your cervix and literally do a sweeping circular motion. The idea is that it would separate your amniotic sac from your lower uterus and stimulate a hormone called prostaglandins, which would then help release oxytocin, which would then help stimulate contractions and ideally put you into labor. I know this might not be the most comfortable mental image that I'm creating for you, and in truth, it's not. It can be a fairly uncomfortable procedure. Some say it's like giving your body a little nudge. Others say it is an intervention and the first start of an induction. Sometimes one small decision in your pregnancy and labor can lead to a series of other events, either wanted or unwanted. And if you're looking for a low intervention birth, you want to think about these small decisions, and membrane sweeps can be one of those. When we start intervening in the natural process of birth, even in small ways like a membrane sweep, it can lead to something called the cascade of interventions. And here's how this can look. You get a membrane sweep, hoping things are moving along, and maybe you start to have contractions, but they're irregular. So you're having these contractions, maybe they're keeping you up so you don't get a solid night's sleep, and this could be lasting for hours and now days, and now you haven't gotten sleep, and it can put you into something called prodromal labor. Prodromal labor isn't false labor. You are having contractions, they are real, but they are not the progressing kind of contractions needed to bring your baby down. Instead of following the typical pattern of getting longer, stronger, and closer together, you're getting contractions inconsistently, and this can go on for days, if not weeks. It might keep you up at night, wear you out, but not actually get you to the point of active labor. When you're exhausted from days of prodromal labor, you're more likely to need or want additional medical interventions like scheduling the full medical induction or even opting for an epidural. And if you were planning for an unmedicated low intervention birth, this could be the opposite of what you actually wanted when really it just started with the membrane sweep. Now, I'm not saying that you're going to be put into prodromal labor just because you get a membrane sweep, but it is one of the risks, and I think it's something that a lot of people just don't know. The best case scenario is the sweep works as it's intended, and you go into labor within that 48-hour period. You and your baby are ready, and everything progresses as normal. The middle ground scenario with the membrane sweep is that you get contractions, but they're irregular. Maybe they start and stop. You might even need a second or third membrane sweep to really get things going. It doesn't start within that 48-hour period, but it could within maybe a few extra days. And the challenging scenario is when you enter into prodromal labor, you have days of irregular contractions, you are emotionally and physically exhausted, and the need for more interventions comes up. Now, going back to performing the membrane sweep, many women say they are quite uncomfortable, even painful. Some say it's like a very uncomfortable cervical exam. You might experience cramping during and after the procedure. You can have light spotting. And again, it can lead to those irregular contractions, and it can lead to this just a heightened emotional state, especially if you were expecting it to put you into labor right away. One important consideration to help decide if a membrane sweep is right for you is the Bishop score. The Bishop score is a scoring system to help determine how ready your cervix is for labor. The Bishop score looks at dilation, effacement, the position of your baby, and how soft or firm your cervix is. If your Bishop score is low, meaning your cervix isn't favorable for labor or you're not close to labor, a membrane sweep likely won't work. Your emotional state is also important too. If you're feeling pressure or anxious to get labor started or get baby out, that can put you into fight, flight, or freeze mode and actually inhibit the hormones that work to put you into labor. So who might be a good candidate for a membrane sweep? Someone who is well past their due date, and again, take due dates with a grain of salt. You have a favorable Bishop score. Ask your provider what your Bishop score is, and you have to also consider if you are doing any vaginal exams to begin with. You have a clear medical indication or reason that you need labor to start, and you feel emotionally ready and have true support in place. You might want to skip a membrane sweep if you're not yet 41 weeks, your cervix isn't favorable, example, if you're feeling pressured or anxious and you want to wait for labor to happen on its own. So here's what I tell all of my birth doula clients to ask their providers if they're offering them a membrane sweep. 1, what is my Bishop score? Why are you offering this to me? Are there any alternatives? And what if we just wait? Remember that every birth is unique. I've had many clients who have a successful membrane sweep and go into labor within 8 or 12 hours. And I've had others who fell into that prodromal labor category and needed that cascade of interventions. My biggest piece of advice for you is to trust your instincts. If something doesn't feel right, listen to it. It's okay to say, not right now, or let's wait. You know your body and your baby best. So lean into it. I hope you found this video helpful, and I hope that you find the support, education, and resources to help you have the birth that you want. Thanks so much for watching. Bye.